The treatment, and we're not going to go through this in any detail, but let me just broadly outline what we do. The bad news on the treatment is that you can't go forward unless you succeed at each step. This is the rule of the game. If I can't win step 1, I can't move to step 2. So I may be struck out before I ever get up at the plate. Number 2, each time you move forward, it gets more difficult, and they take time. This is not something that most doctors, most certain surgeons, God knows how I ever got into chronic pain. That just shows how disordered my life has become. Most surgeons just haven't got the time or inclination to deal with these people. The good news is that the steps are beneficial all by themselves, that getting part way is better than not getting there at all. So there's nothing that you shouldn't try. The steps keep the pain, you're not making them worse. You're not doing the wrong thing and like the canoe going backward on the current. And you can stop whenever you run out of patience and energy. These people suck. These people really take it out of you. The psychologist will tell you that you mirror what they do, and you realize this. The patient's depressed, you're depressed. 2 minutes with one of these people and oh my God, they're angry. Then you get angry and you fight with these people. They take out of you the very emotion that they are projecting. So be very careful. Keep your sanity. We treat these people in groups. We rarely treat them one-on-one. We gang up on them. 2 or 3 people work together on the same patient because otherwise they'll destroy you. Step 1, yes?
When you say in groups, you mean you get a group of patients together?
Both. Patient groups work very well, but you must be very careful of the least, the bad apple in a group can destroy the group. So you got to be very quick to segregate that person. I'm sorry, but come see me tomorrow at a different time. We also use a therapist, a psychologist sometimes, although we don't often, 2 or 3, a doc, it doesn't matter. But each of us has the same message, because this is the point. We're talking to you, and you're hearing from me what you're hearing from him, what you're hearing from her, because they're very quick to divide and conquer. They're fascinating people. I'll tell you that I can't work, and then I'll tell him I can, and I think the 2 of you never talk to each other, and the fact is you don't. And that's why the doctor says, at clinic you're hurting this guy, and at the clinic he says, my doctor won't let me come. You've got to keep communication. So the best way to get this, now this is an interesting little flip. The best way to gain their trust is to talk about their pain. The very thing you don't want to do. You focus on the thing you're trying to eliminate until you gain their trust. My big beef with pain clinics is the fact they're called pain clinics. I can't think of a worse place to send someone focused on pain than a pain clinic. And every day they walk in, the big sign says pain clinic. Oh, good, I'm here because I have pain. I'm going to have it as long as I'm here. I mean, it just doesn't seem to make sense. Get their trust, talk about their pain until they trust you. Then explain why they hurt. And I'm not going to go into the details, but it's very mechanical. We in our courses, we actually get people to come up and explain pain to each other. It's really quite a lot of fun because some of the descriptions are kind of exciting. But the point is this, it's mechanical, it's physical pain. Don't ever tell them that they're crazy. Tell them that their pain system isn't working right. There's dozens of examples that we use. A simple one, I have a computer and the computer's broken, and every time I push a button on the computer, all the screen shows me is the word pain. It should show me all sorts of different things, but it doesn't. It just says pain. Every time I hit a button, it doesn't matter what button I push. Think about it. I put my clothes on, they should feel like normal clothes. They hurt when I put my clothes on. You poke me, it hurts. It shouldn't hurt. Why? Because your computer's busted and every key you punch talks about pain, and on and on and on. Step 3, explain why this has happened. Explain it. Give them the knowledge that their system is not right. And that in turn leads to step 4, which is what am I going to do about it? If you can understand the computer analogy, and I can say, well, it's because the wiring is not right in the computer, well, then the logical next step will be, well, then how can I change that? How can I begin to behave normally again? And that leads you to step 4. Oh, and step 3, I'm going to give you a couple of other things, because these are important. Every one of these descriptions must carry this statement, that the pain you have affects your thoughts and behavior, doesn't it? And every pain patient says yes. Every pain patient. Your pain makes you do what it makes you do. Yes, it does. Oh, my pain runs my life. They know that. All right? Well, did you realize that the way you behave can change your pain? This is cognitive restructuring. This is nothing more than cognitive restructuring. And did you know that if you act differently, you will feel differently? The truth is you will. It's not easy. And again, we can go into how you sell that message. But the message needs to, if you want to be happy, act happy. If you want to have no pain, act as if you have no pain, which is not an easy thing to do. And the patients misunderstand this, and they talk about being tough and carrying on and grimacing and crying, and that's not what I said. What I said was, I want you to act as if I look at you and I don't know you're in pain, which means you have to completely change your external behavior. You must discuss that the behavior that you have can remold the nervous system. We talked about the fact that the nervous system is plastic, that stimulation changes it, you can change it back. It's an indirect process, and it's gradual. Those two words must be there. It's an indirect process and it's a gradual process. You're not going to just change overnight, but you can if you work on it. It's artificial. I'm asking you to act in a way that is not normal. And we go into this in some detail, but this is the key message. This is not be tough, suck it up. This is I want you to act differently than you feel. You've got to change your behavior before you change your pain. One of the standard lines at this point is, well, as soon as I don't hurt, I'll act normal. No. You will act normal before you stop hurting, because it's only by acting normally that you will be able to change the pain. And it's a bloody hard thing to do. I tell them that it's the toughest fight they've ever had. I say, look, you're in a room with one door. You walk through the door with me, we win. Otherwise, you're going to stay in this room forever. It's your choice. And if they fail, like a smoker who lights up again, you can always start over. Step 6, the method. And the method is to change the focus, and it really comes down to scheduling. We use little scheduling books. We talk about planning your day with no reference to your pain. This is a big part, and I'm going faster than I know I should. But what you do is you get them to plan tomorrow without reference to their pain. These people have no schedule. These people are trapped in this life where pain runs everything. You're telling them to take their life back and to do it by saying, tomorrow morning at 9 o'clock, I will be here. Now, for us, this is normal. All of you yesterday, when you finished this course, knew in your schedules you would be here this morning. If you were a pain patient and I said to you, where will you be tomorrow morning? You would have said, well, if my pain lets me, I'll come back. But I may be too sore to get out of bed. I don't know yet. I'll see what my pain does. You change that by giving them back their lives in a schedule. And this is just cataloging it, easy things, making sure the routine evens out so that even on their bad days, they can do what they have to do. It's really all about changing behavior. You put it in writing. You record the success. These are failures in their own minds. All I want you to do is show me that tomorrow you got up when you said you would and walked around the block when you said you would, and those are successes. The visual record of success is part of what we give these people to treat them, and it works. Schedule medication, schedule sleep, plan everything. Plan without regard to pain, and the rest of this is way beyond where I want to go now. Step 5 is cognitive distortions, and this is a direct challenge. This is the cognitive part of it. This is, I'm a failure, the world is going to kill me, everybody hates me, I think I'll go eat worms. It's all of that. And basically what you're trying to do is change it, but it's difficult. This is a direct challenge to what you believe. I'm going to tell you that what you think about yourself is wrong. Well, they're not going to take that from me unless there is a sense of trust, number one, and some progress, so that the patient can say, yeah, I'm a little better than I was. Then I can say, oh, by the way, did you know that all of these things, the all or nothing thinking, the everybody hates me, the all I can see is the bad stuff, all of these cognitive distortions and more can be addressed. You can address them as you proceed through treatment, but essentially this must be done. And then finally, get them back. Get them back to work, get them back to life, and that's it. And it really is a big issue. Now, you can't save them all. Even in the best of programs, about 20% do well. About 20% do not bad. And about 60% you blow it. Now those are depressing numbers. I mean, they're bad numbers, but they're the best numbers you're going to get. And it's a damn sight better to try, knowing that you will win occasionally, than to just do it wrong, make them worse, and win nobody. And those of us that live in this world and treat these people have all had amazing successes. That's what keeps you going. You know, every so often you'll get one that really does, you link, you score, the patient's life changes. I had a man sit in my clinic for almost 4 hours to say thank you. Amazing. The guy sat there for most of an afternoon for no reason but to tell me he thanked me for what I had done. I didn't operate on him. I talked to him about chronic pain. I've never had a surgical success wait 4 hours to say thank you. But I've had a pain patient do exactly that because his life had been completely changed. I didn't do it, he did it, but he bought into what we're selling. It's worth a try. You know, it's so simple. All they got to do is gnaw down the tree and dam the river. And the trouble is, you know, it doesn't always work that way, but that doesn't mean you shouldn't give it a shot. Thanks very much. And that